to start things off, you know, we're going to talk about something that's important to everybody, our vision. For people with vision issues, the options for being able to see clearly had typically included wearing glasses. We know a lot of people do that, or contact lenses for a temporary fix.
Yeah, the permanent correction option of LASIK eye surgery is also quite popular, but typically it's not an option for children.
That's right. I recently learned about another great option that allows you to leave the glasses and contacts at home and doesn't involve a surgical procedure. Today, we're exploring Ortho-K at Rockford Family Eye Care. Okay, we're counting down to back to school, and that means getting our kids ready on all levels, including with their vision. We're here at Rockford Family Eye Care with Dr. Theodore Cease, and we're talking about a big problem that a lot of kids are facing, and that is with the need for vision correction.
That's correct. A lot of kids have a lot of problems as far as needing reading glasses, needing glasses for far away. Everybody's different, but most kids at some point will need some sort of correction. It usually kind of depends on your genetics, but at some point there usually is some correction that's needed. And
this is really becoming a bigger problem, more of the population having to deal with issues regarding their vision.
That's true. In 1970, only 25% of the population was nearsighted. Now it's about 50%, and in some Asian countries it's 90%. So there's a problem with that, and it's not necessarily that your vision's getting worse, it's because there's other ocular complications, including glaucoma and retinal detachments. That's why the CDC has considered it an epidemic.
And we don't like to think about those terms with our kids, especially if you talk about kids in their teens or even elementary school age. So let's talk about some of the processes, because I know here at Rockford Family Eye Care, you're all about really helping to make sure that these kids, their vision stays as good as possible. And you have a treatment program here called the Ortho-K. What is that?
Well, Ortho-K, or Orthokeratology, is a contact lens, or it's actually a corneal mold that you wear while you sleep. What it does is it reshapes the front layer of your cornea into a form of a reversible LASIK or a reversible correction. So what you do is you sleep in the contact lenses or you wear the contact lenses while you sleep. You wake up in the morning, you take your contact lenses out or the molds out, and you have 20/20 vision without contacts or glasses. What's nice about that for some people is they can go multiple days without wearing their contact lenses at night. Some people can go up to a week. It just depends. Everybody's a little bit different.
And so you think about that with especially kids. I'm guessing typically if you start out and your vision is already compromised, it can be one of those things that deteriorates in some cases very quickly.
And that's the problem with kids, is their eyes continue to change, and that's why you don't do LASIK until your eyes are stable. But with orthokeratology, what it can do and what it's been proven to do is reduce that progression up to 50%, and a lot of times it stops it altogether, which is great for kids because you don't want your eyes getting any worse than what they are. This works really well for adults too. Usually adults' visions are usually not progressing, so they don't have to worry about that. But the bigger concern for adults is if they have dry eyes and they can't wear contacts during the day, or they're really athletic, or they really would like to go without glasses or contacts, Ortho-K works awesome for that.
Okay, so walk us through the process. How exactly does it work? I guess it would start with an appointment here at your office.
Yep, what they do is we schedule an appointment and we check their vision. We just make sure their ocular health is good, and then we check to see what their prescription is with their glasses or with contact lenses. After that, we do what is called a topography, and that maps the front part of your eye. And because everybody's eyes are different, we have to map that eye, both eyes actually, and then from that we put it into a software and we do the calculations to determine what mold would work well for you.
It sounds like it's not one size fits all. It's specific for each individual patient.
It is, and that's why it's a little bit complicating, but it works really well once we get that right fit. It works amazing.
Even for kids as early as 13 or 14?
I've had younger, so it can go. Kids are actually very good about putting contact lenses. They're a lot better than adults sometimes. They're just very adaptable. They can do things on their own, and they like to take charge, and they like to do the adult things, and they're really good.
Skylar's 13, and you do the Ortho-K. Tell us about it. How does it work for you, and what has the improvement been for your vision?
Well, I wear it at nighttime, and I wake up in the morning, take it out, and then I can see perfectly fine, and I don't got to worry about a glare like when I look at a light.
It's really been life-changing for her. She just simply puts them in at night. She's real good about it. She takes them out in the morning, and it's really been life-changing.
I love it, and because I can go swimming. I don't have to worry about, you know, my glasses breaking, or I don't got to worry about losing anything. And it's just amazing.
So if you or a family member have some sort of vision issue, consider traveling to Rockford. Rockford Family Eye Care and the offices of Dr. Theodore and Carrie Cease. Yeah, you were just peppering me with so many questions. As someone who wore glasses and contacts for years, I was really just so impressed with Ortho-K. As Dr. Cease explains, the patient wears these specially fitted lenses overnight while sleeping and then removes the lenses in the morning. They're gas permeable, which means they're a bit harder than traditional soft contact lenses. And so the lenses are firm enough to reshape the eye overnight. And it's that process that brings the patient that much needed improvement to their vision.
Okay, so how does this compare to LASIK surgery? What do the doctors at Rockford Family Eye Care say about LASIK? Because that's what we hear about all the time.
We hear a lot about LASIK. The doctors at Rockford Family Eye Care are pro-LASIK, but Dr. C says since children and teens aren't really candidates typically for LASIK, since their eyes aren't completely done developing and changing, Ortho-K does provide that option. Also, much, much cheaper than LASIK.
That's nice.
Exactly. Yeah.
You know, I wish I would have known about this a long time ago, because I've been wearing contacts and corrective lenses since I was in 6th grade.
Right, and you are a candidate.
I am.
Jordan, it's something that maybe you want to check into.
I would love to. And Dr. Cease and his wife are both optometrists at Rockford Family Eye Care, located on 10 Mile Road in Rockford. Give them a call for more information at 616-951-7115.
Carrie, you said there weren't a lot of places that actually do this, and so this is a great to know that Rockford Family Eye Care does offer this to families and people.
And it's not very well publicized as a result. That's why I think so many of us hadn't heard about it, and so it's perfect timing because of the countdown to back to school.
That's right.
As we mentioned, just 4 weeks away for a lot of kids.